The Senate Committee on Health, Education, Labor, and Pensions will please come to order. About 5 years ago, Richard Streeter, a 47-year-old truck driver from Eugene, Oregon, was frustrated and worried. As New York Times columnist Nicholas Kristof described in his column this weekend, Mr. Streeter couldn't find affordable insurance in the individual market. Back in the bad old days, no insurance company would cover him. So he did what people locked out of the market do. He just went without care. After months of ignoring pain, Mr. Streeter finally went in for a colonoscopy. But he couldn't afford one. The only way he could get it was from a doctor who agreed to take half payment now and half payment later whenever he could afford it. After driving 100 miles to get the results, he found out he had advanced colon cancer. His doctor said this, and I quote, "It was heartbreaking to see the pain on his face. It got me very angry with people who insist that Obamacare is a train wreck, when the real train wreck is what people are experiencing every day because they can't afford care." Mr. Streeter is the second patient the doctor had seen this year who put off getting a test because of a lack of health insurance and now has advanced colon cancer. He has a long, tough road ahead of him, but at least now he won't have to worry about how he'll pay for his treatment. He signed up for health insurance starting January the 1st, which now can't turn him down because of his pre-existing condition. We passed the Affordable Care Act so that this would never happen to another family. Right now, millions of Americans are shopping on new health insurance marketplaces for coverage that starts next year. 700,000 people have filed applications. And why is there this surge in this interest? Because for the first time in history, their health, whether or not they have a chronic illness or an allergy or had a back operation 10 years ago, will not prevent them from getting insurance. These reforms will finally deliver on a long overdue promise to all Americans. If you work hard and play by the rules and pay your fair share, you'll never have to stay awake at night worried that you can't afford to see a doctor or pay your medical bills. It's a promise I wish we could have kept sooner for Mr. Streeter. So today we'll hear a status report on the implementation of these reforms. As everyone knows, the rollout of the federal health insurance marketplace has been bumpy, to put it mildly. Consumers have run into roadblocks. The site has been functional one day, unresponsive the next. Americans who have been waiting for years for this moment deserve better. The President, Secretary Sebelius, and our witness today have taken full responsibility for the technical flaws in the website and have said that no resource will be spared to fix the problem quickly, and I look forward to hearing an update today on those efforts. I share my Republican colleagues' concern about the website's technical flaws and the bumpy rollout, and I look forward to a discussion about how we can move forward. But I want to be very clear, I hope we're here for a constructive discussion, not a game of gotcha. I'm as upset as anyone with the difficulties that individuals who want to apply for coverage on the federal marketplace have experienced, and I want to learn today how those problems will be fixed. But herein may be a difference. I want it fixed so the Affordable Care Act will succeed. Will succeed, not be torn down. There are many who have spent the last 3 years doing nothing but trying to tear this law down. Quite frankly, I feel they've kind of surrendered their right to express indignation that it's not working flawlessly. We voted 32 times. Many of my colleagues on the Republican side, 32 times to repeal or defund the law. As an appropriator and as chair of the Appropriations Subcommittee that funds the implementation of this law, my Republican colleagues year after year have denied implementation funds at every turn, tried to stop navigators from spreading the word. They even sent letters to the National Football League warning them against reaching out to fans. Republican governors and legislatures, who in most cases ran on a platform of strong states' rights and less federal government, handed over the responsibility of running the marketplace to the federal government. Before we get into the details, I think everyone should take a deep breath. This is, after all, a website. This is a machine that will be fixed. Americans have until the end of March next year to sign up. As the President said, the promise of the Affordable Care Act is far more than just a website. The promise of the Affordable Care Act is a benefit to 105 million Americans who have been protected against lifetime limits since 2010. It's the benefit to more than 3 million young people who can stay on their parents' policies until they're age 26. It's a benefit to 7 million seniors who have already saved $8 billion in discounts on prescription drugs. It's a benefit to the 71 million people on private insurance that have used at no cost and no copay preventive services, which Mr. Streeter could have used had this law been in effect. It's a benefit to the 129 million non-elderly Americans with pre-existing conditions who, beginning January the 1st, can no longer be denied or discriminated against by health insurance companies. That's the big picture, and we shouldn't forget it. Health reform is the promise of the health and financial security that insurance coverage brings. I can tell you that in Iowa's marketplace premiums are among the 10 lowest nationwide. A family of 4 making $50,000 will be able to get bronze-level coverage for $103 a month. A 27-year-old making $25,000 will be able to get a plan for less than $100 a month. That's real choice, real affordability. So, let's get the website fixed as fast as possible so that every American can shop easily and enroll smoothly. But let's not forget the big picture. That because of Obamacare, if you want to call it that, or the Affordable Care Act, millions of Americans will not be in the same situation as Mr. Streeter found himself. That's what it's about. Slowly but surely, Americans who have waited years to get covered are enrolling in health insurance for the first time. We owe them our very best efforts to move the ball forward. And so I will be listening closely when questions are asked today of our witness. Is this in order to help and fix this system so we can move forward to make this Affordable Care Act work? Or is it another means to try to tear it down and discourage participation? I want to thank our witness, Commissioner Tavenner, for her leadership of the Center for Medicaid and Medicaid Services and for her long dedication to making sure our health care system in America works for all. I know we'll have some tough questions. That's fine, because I do want to know why this problem came up. But I want to keep the big picture in mind as to what we're really doing here, and that is to make the system work. Finally, I have one administrative matter. I request that the record remain open for 10 days from today for statements to be submitted for the record. And now I'll turn to our ranking member, Senator Alexander.
Thanks, Mr. Chairman, and welcome to Ms. Tavenner. I used to, when I was in President Bush's cabinet, I used to testify before this committee from that seat, and I used to think the senators deliberately put the chair down low so they could be up high. So we welcome you. My late friend Alex Haley used to say, Lamar, if instead of making a speech, you just tell a story, somebody might listen to you. So here's a story. 16,000 Tennesseans have insurance through Cover 10, a low-cost, narrow-coverage state program. Obamacare is canceling their policies. Cover 10 is an example of what President Obama calls bad apples, an insurance plan that Washington decides isn't good enough for you. I recently heard from one of those Tennesseans whose policy will be canceled on January 1st. Her name is Emily. She's 9. She has lupus. She told me, I cannot keep my current plan because it doesn't meet the standards of coverage. This alone is a travesty, she said. Cover 10 has been a lifeline. With the discontinuation of Cover 10, I'm being forced to purchase a plan through the exchange. My insurance premiums alone will increase a staggering 410%. My out-of-pocket expense will increase by more than $6,000 a year. That includes subsidies. Please help me understand how this is affordable, says Emily. Our health care system makes up nearly 20% of our economy. touching the lives of every American. And today, Obamacare is pushing that 20% of our economy in the wrong direction. The President has said repeatedly, and I looked up the White House website this morning, if you like your plan, you can keep it. And you don't have to change a thing due to the health care law. Let me repeat, you don't have to change a thing due to the health care law. That's the White House website today. But as the President said, it's a law transforming our health care delivery system in the wrong direction. It's more than a website, as the President said. It's a law transforming our health care delivery system in the wrong direction, we believe, by increasing premiums, canceling insurance plans, destroying relationships with doctors, raising taxes, forcing people into Medicaid, spending $500 billion Medicare dollars on new programs instead of making Medicare solvent, and encouraging employers to reduce their employees to a 30-hour work week. And then having the IRS fine Americans, or threaten to fine them, for failing to sign up for insurance on a website that doesn't work. As the President promised, if you like your health care plan, you can keep it, but in fact, the plan cancels millions of individual policies. And for millions of others, employers are dropping insurance programs as they discover the added costs of Obamacare. For these Americans, the new promise is, if you want health care, go find it on a website that the administration says won't be working properly until the end of November. That's an unwelcome Christmas present. Only 2 weeks to shop for and buy a new insurance policy by December 15, so that you're covered next year when Obamacare outlaws your policy. Ms. Taverner, the President put Secretary Sebelius in charge of implementing this law. I've called on her to resign because it's hurt so many Americans. Before the Internet, RCA could tell you every day how many records Elvis was selling. Ford could tell you how many cars it was selling. McDonald's could tell you how many hamburgers it had sold. Congressman Issa has posted on his website notes from meetings in the Obama administration's war rooms where you're apparently telling each other how many people are enrolling in Obamacare, but why won't you tell Congress and the American people? One senator has described this law as an approaching train wreck. Well, my grandfather was a railroad engineer in Kansas. His job was to drive the locomotive onto a round table, they called it, turn it around and head it off in the right direction. That's what our country needs to do. We need to turn this train around, turn the law around, head it in the right direction. Obamacare is the wrong direction because it expands a health care delivery system that we already knew cost too much. The right direction is more choices, more competition, that lower costs so Americans can afford to buy insurance. Now, don't expect Republicans to show up on the Senate floor with our version of a 3,000-page bill to try to move the health care delivery system in the direction we want it to go. We don't believe in that approach. We believe instead in moving step by step in the right direction. Make Medicare solvent. Reform Medicare Advantage to compete with Medicare. Make Medicaid flexible. Encourage employee wellness plans, small business plans, expand health savings accounts, buy insurance across state lines, change 30-hour work weeks to 40 hours. That 39-year-old Tennessee woman I told you about, Emily, who's losing her insurance because Obamacare has decided it isn't good enough for her, finished her story with these words, quote, "This is one of the biggest betrayals our government has ever committed on its citizens. I beg of you to continue to fight for those like me," she says, "who would only ask to be allowed to continue to have what we already enjoy, a fair health insurance plan at a fair price. Please find a way to return to affordable health care," writes Emily. My message to Emily is that we will do our best to turn this train around and head our health care delivery system in the right direction so that you can buy and keep health care that you can afford.
On behalf of the committee, I'd like to welcome our witness today, Marilyn Taverner, the Administrator of the Centers for Medicare and Medicaid Services. She was confirmed by the Senate on May 15th of this year. Prior to her confirmation, Ms. Taverner was Principal Deputy Administrator for CMS. She also served for 4 years as Governor Tim Kaine's Secretary of Health and Human Resources in Virginia. Before entering government service, Ms. Taverner spent 25 years working for the Hospital Corporation of America, and she began her career as a nurse at the Johnson Willis Hospital in Richmond. Ms. Tavner holds a Bachelor's of Science degree in nursing and a Master's degree in health administration, both from the Virginia Commonwealth University. I know you're very, very busy these days, but I thank you for coming up here to share your experience and answer questions here today, Ms. Tavner. And now what I'd like to do is, since this is such an intricate subject, we usually give the witness 5 minutes. I would, with the indulgence of the committee, like to give you up to, but no more than 10 minutes to make your opening statement, and then we'll have our questions. So welcome, and your statement will be made a part of the record in its entirety. Please proceed.
Thank you, Chairman Harkin, Ranking Member Alexander, and members of the committee. On October 1st, we launched one of the key provisions of the Affordable Care Act, the new marketplace where people without health insurance, including those who could not afford health insurance and those who were not part of a group plan, could actually go get affordable health care coverage. We know that some consumers are still having difficulty enrolling via the marketplace website, and we are focused on identifying and solving those problems quickly. But it is important to remember that the Affordable Care Act is more than just a website. It has created a new market which allows people access to quality, affordable health insurance options. It does this by pooling consumers into statewide group plans that spread risk between sick people and healthy people, between young and old, and then bargains on their behalf for the best deal on health insurance. By creating competition where there wasn't competition before, insurers are now eager for business, have created new health care plans with more choices. The premiums for coverage on the marketplace are lower than expected, and millions of Americans will also qualify for tax credits to make this coverage even more affordable. People will have comprehensive coverage that cannot be taken away, even if they get sick. We know that consumers are eager to purchase this coverage, and I want to assure you that healthcare.gov can and will be fixed quickly, and we are working literally around the clock to make that happen. We have made significant progress in improving the performance and functionality of the website, and we expect the user experience to continue to improve with each passing week. Over the past month, millions of Americans have visited healthcare.gov to look at their new health care coverage options under the Affordable Care Act. In that time, nearly 700,000 applications for coverage have been submitted from across the nation, more than half in the federal marketplace alone. This tremendous interest confirms that the American people are looking for quality, affordable health care coverage. We know that the initial consumer experience on healthcare.gov has been very frustrating for many Americans. Some have had trouble creating accounts and logging into the site, while others have received confusing error messages or have had to wait for slow page loads or forms that fail to respond in a timely fashion. In the first few days that we went live, few consumers could create an account. We have now resolved that issue. Users can successfully create an account and continue through the full application and enrollment process. We are now able to process nearly 17,000 registrants per hour, or 5 per second, with almost no errors. We've updated the site several times since October 1, fixing bugs and improving the healthcare.gov experience. We've added more capacity, and we've doubled the number of servers in order to meet demand. We reconfigured various system components to improve site responsiveness. This has increased performance across the site, but in particular, the viewing and filtering of health plans during the online shopping experience. This now responds in just seconds, whereas it was taking minutes before. We've also resolved issues so that eligibility notices now display properly to consumers at the completion of the application process. Consumers can now view and compare plans without registering for an account. This functionality was not working well in the days leading up to October 1, so we opted to prioritize work on the application process instead. One of our highest priorities was ensuring that consumer information was transmitted correctly to issuers. Over the past week, our team has worked with issuers to resolve outstanding issues, and now all necessary consumer information will be sent to issuers after they've enrolled in the plan of their choice. We will continue to work closely with issuers to identify and solve problems quickly. We've also seen success in improving response time across the website. For the first few weeks, we estimate that users were waiting on average 8 seconds for pages across the site to load. We've now lowered this time to less than 1 second, and we will continue to take aggressive steps to bring response down time even further. We are pleased with these quick improvements and the parts of the system that are already working well. For example, the Data Hub, the routing tool that provides an efficient and secure way to verify information submitted by consumers, is sending determination to the marketplace in less than 1.2 seconds. The Social Security Administration has reported 4.2 million transactions with the Hub, and the IRS has responded to more than 1.3 million requests. When consumers fill out the online application, they can trust that the information they're provided is protected by stringent security standards and that the technology underlying the application process has been tested and is secure. CMS has decades of experience at protecting personal information in Medicare, and we are extending that commitment to the highest security standards for the marketplace. Any system that is this large is inherently risky. We have continued to monitor the security of the system as envisioned in the Risk Mitigation and Compensating Control Plan and have had no serious issues. Security testing never ends, it will never end, and it will not for this system or for any other large system. While we continue to improve healthcare.gov, it is important to remember that the website is in fact working and more people are applying and enrolling each week. In addition to the website, there are other ways for consumers to approach healthcare.gov. One is they can choose to apply by phone in a 24/7 toll-free number. A customer service representative will work with each consumer to make sure that they can complete the application and enrollment process. Second, people can find in-person help in their communities and work with people trained or certified to help them understand their health care options. Third, consumers can fill out a paper application and mail it in. They'll find out whether they're eligible for private insurance, Medicaid, or CHIP, and then they can go online to compare, choose, and enroll in a plan, or they can contact the call center and do it by phone if they prefer. Today, more than 3 out of every 4 Americans get insurance from an employer, from Medicare, from Medicaid, or from the VA system. Americans who purchase insurance on their own, however, generally buy coverage on the individual market. Before the Affordable Care Act, coverage in the individual market often was unaffordable, had high copays or deductibles, or lacked basic benefits like maternity care, mental health services, and prescription drug coverage. These plans also had high turnover rates, greater than 50% per year frequently, and often were not renewed at the end of a plan year. The health care law is creating new protections for people in the individual market, as well as strengthening employer-based coverage. In the health insurance marketplace, consumers will no longer be charged more because of their gender or pre-existing condition. Recommended preventive services will be covered at no additional out-of-pocket cost. There will be caps on out-of-pocket cost, and plans will have to offer a basic package of 10 essential benefits. Plans that were in place before the Affordable Care Act passed and have not been changed in ways that substantially cut benefits or increase cost sharing are grandfathered in and are exempt from offering most of the new consumer protections. They must notify their enrollees that they are grandfathered plans, however, and for these enrollees, nothing has to change in 2014. Some of the 5% of Americans who currently get insurance on the individual market have recently received notices from their insurance companies suggesting that their plans will no longer exist. These Americans do have a choice. They can choose a different plan being offered by their insurer, or they can shop for coverage in the marketplace or outside the marketplace. As insurers have made clear, they are not dropping consumers. They're improving their coverage options, often offering better value plans with additional benefits. Indeed, the majority of people in the individual market today will qualify for discounted or free health care coverage when signing up for coverage through the marketplace. One study found that, not counting the 1 million who qualify for Medicaid, 48% of people who buy insurance through the individual market will have a tax credit that averages over $5,500. The Affordable Care Act is almost 4 years old now, and during its time, we have seen many improvements in our healthcare system: Medicare, Medicaid, Medicare Advantage. The opening of the marketplace on October 1 is the latest step in the implementation of the law, and we acknowledge that we have a lot more to do, and we're ready to do it. Thank you, Mr. Chairman.
Thank you, Commissioner Tabner. And now we'll start a series of 5-minute questions. I know everyone's got questions. I'm going to hold myself and everyone else to 5 minutes. It might be you only get one question, but that way we can go around once, we'll go around twice, we'll go around 3 times, as long as it takes, so that people can get their questions asked. But I hope that we'll just keep within 5 minutes so everyone gets to ask a question. So we'll start now. Ms. Tabner, as we evaluate the problems with the website, it's important to get the facts straight. Some have said that fixing the website could take 6 months to a year. Others state that there are 5 million lines of code to rewrite. Some have urged you to pull down the entire system, start from scratch. So I hope you can bring some facts to this much overheated debate. I understand this can get very technical very quickly, but I want to give you an opportunity to explain the problems with the site and the path forward just in plain English. What's the plan for fixing the website? Who's leading the effort? And what is your role in this work? And what's your expected timetable for a process to run smoothly?
Let me start with the plan. As you all are aware, we engaged QSSI to serve as the general contractor. They were engaged last week, so they will be leading the effort, working with me directly. They will be responsible for coordinating contracts. I would describe the problems with the website in 2 categories. The first problem had to do with performance and speed. And so we have had added capacity and we've made system performance improvements. That has to do more with what I would call the hardware side of the equation. That work was done immediately. Although we had projected demand for the website, we obviously underestimated that demand, and so we had to go back and catch up and add additional capacity and improve performance. And that's some of what I was referring to in my opening comments about the slowness of the system as you were going through pages. The second issue has to do with software improvements. The first big one was the ability to establish an email account. That was a problem that we solved in the first week. We've had success there. There is not the problem with establishing an email account or going on to be identity proof. That problem has been resolved. So now we're into what I would call the internal piece of the architecture inside. I'll remind you that this website is covering 34 states and 50 Medicaid programs, and also services the state-based exchanges. So it's pretty complicated. We knew all along we would have bugs in the system. I think we obviously had more bugs than we realized, particularly around the application. So we actually are doing series of software upgrades pretty much several times a week. We will continue that. You will see improvement week by week, but this is weeks, not months, and we are not rewriting the architecture.
Could you address yourself to the issue of security? There have been several reports that you and others had concerns about the site's security protections leading up to October 1st. Could you discuss your concerns, how were they addressed, and what efforts are we making to ensure that consumers' information is secure?
Let me try to take the security question in a couple of different buckets, because I think there's been a lot of confusion around security. First of all, in the hearings over the summer, a lot of the questions that I answered and others answered had to do with security of the hub. And security, the hub is actually, the contractor there is QSSI. The hub serves not only the federal marketplace, but all of the states as well, and has been a smooth operating system. That security, including end-to-end testing, was completed by September, and there was sign-off on the hub. When it comes to the FFM, or the actual exchange, there was security testing by component, And then we did a short-term authorization to operate because we knew we were going to be making software enhancements. We had announced prior to October 1 that we were not going to bring SHOP up right away. We were not bringing the Spanish website up right away. So we did a temporary or short-term authorization to operate because we knew we would have to do continuous security testing while those programs were being installed and while software was being upgraded, which is routine. So I think there's confusion about what was tested and what was not tested. So I need to separate those.
I only have 27 seconds.
Sorry.
When someone comes on, how will they be assured that their Social Security number, for example, will be kept secure, that no one can hack in and take their Social Security number?
Yes, and remember that the hub does not store any information. The hub is a router, so when you go in and fill an application, it pings, if you will, Social Security. It pings the IRS to validate your income, to validate your citizenship, to validate your Social Security number, but that's not stored. What is stored is in your individual application, which is secure, and that was part of the secure or the identity proofing on the front end. That was a little complicated because we had taken additional steps to make sure that an individual application was secure. Now, in addition to all this, we also have continuous monitoring of all systems, which is something we do for Medicare as well.
Thank you very much, Ms. Tabner. Senator Alexander.
Thanks, Mr. Chairman. Ms. Tabner, let me go back to the President's words. I'm sure you'll be able to fix the website, and I'm not as concerned about the IRS fines that will come next year. What I'm more concerned about are the canceled policies and the inability of people to have time after you presumably fix the website by the end of November to replace their policies by January 1 so that they'll actually have health insurance. And I'm concerned about the kind of health insurance they get because of the large number of cancellation letters that are coming into our office from Tennessee. So let me suggest that a way to fix this problem of canceled policies in the individual market is to go to a website that does work pretty well. It still says, if you like your plan, you can keep it, and you don't have to change a thing due to the health care law. That's the White House website. Those are the President's words in 2009. So why don't we put those words into law? Why don't we solve the problem of Emily, the lady I read about from Tennessee, who's losing her Cover Tennessee insurance and finding that to replace it, it'll cost 410% more. Senator Ron Johnson has introduced a bill that he calls, if you like your health care plan, you can keep it. It would basically put the President's words into law and assure those millions of Americans like Emily that they'll be able to keep a plan like Cover Tennessee, and she won't be out of insurance on April 1. We're talking about millions of Americans, so my question to you is, would the administration support Senator Johnson's bill, which would put the President's words into law, by saying to Americans that if you had a plan before the law was passed on March 23, 2010, or even a plan all the way up to the end of this year, that you can keep it? Wouldn't that solve a lot of problems and reassure many Americans that they can have affordable health care?
Senator Alexander, when we wrote the regulation back in 2010, that's exactly what we did. We grandfathered in existing plans, both in the employer market and in the individual market. There was a lot of back and forth about that regulation. What was the phase in time? So that's why we delayed it until we said basically plans could be grandfathered over this period of time. And also we allowed the grandfathering to continue as long as it did not reduce benefits significantly. There were some things put in place. So I do think we put in steps the ability to keep plans. Now, in these cancellation letters are also followed by a statement in each of them that says...
Ms. Tavener, I want to give you a chance to answer, but will you support Senator Johnson's bill?
I would not. I have not even looked at Senator Johnson's bill. I'm happy to look at any.
Well, I'll get a copy to you. If I may say, we know about the regulations that were written in 2010. They effectively made it impossible to grandfather a lot of the plans that people had. And according to your own regulations, it was estimated that 40 to 67% of those individual policies wouldn't be able to be grandfathered because of all the conditions you put in the regulations. So in effect, didn't you know in 2010 that there'd be a big turnover in these individual policies and that it was wrong to go across the country saying that if you like your plan, you can keep it without having to change a thing?
I don't think the regulation assumed that it was because of the grandfathering that these plans would change. These plans routinely change. The churn in these plans is greater than 50% per year, often not renewed. People move about this market. This is part of what the Affordable Care Act was designed to do, is try to stabilize this market and give individuals some protection.
But your regulations said if you increase cost sharing, co-pays, change the employer contribution, change the fixed amount, change the benefits, all of those would mean that those plans didn't continue. And basically, Washington is saying to people like the 16,000 who lose their Cover Tennessee plan, we know better than you do what is a good plan for you. We want you to buy a better plan, even though you like the plan you keep. So why not put the President's words into law and simply say, if you like the plan you have, we're not going to decide for you. You can decide it, you as an individual. If you like the plan you have, you can keep it without having to change a thing. That's what's on the White House website today.
Senator Alexander, for those 16,000 individuals that you listed, they were also given the option of renewing with a new plan. And yes, maybe some of those plans were more expensive, but I would encourage those individuals to go on the website, take a look at what's available in the individual market in Tennessee. I think you will see that the pricing in the individual market actually came in about 18% lower. Also, some of these individuals may qualify for a subsidy. And so I would just encourage them to look at their current issuer, but also to go on the website, take a look at plans that are available in Tennessee, and also check to see if they qualify for subsidy.
Thank you, Mr. Chairman.
Thank you, Senator Alexander. Senator Mikulski.
Good morning, Administrator Tavener. Actually, I'm glad to see you, and I hope you're doing well. We're very proud of the fact that CMS is headquartered in Maryland, and there are thousands of people who work there every day in every way trying to make sure Medicare, Medicaid, and now Obamacare is delivered effectively and efficiently. Even though you've been revenue-starved and kind of battered around in the failure to confirm permanent administrators. But we'll put that aside for this conversation, because the launching of the Affordable Care Act has been more than bumpy. I believe that there's been a crisis of confidence created in the dysfunctional nature of the website, the canceling of policies, and sticker shock from some people. In my own state of Maryland, it was also bumpy. We've read in the Baltimore Sun this morning that 73,000 Marylanders' policies will be canceled. So there's been fear, doubt, and a crisis of confidence. So let me get to where I am, because it's not to finger point, it's to pinpoint. What I worry about is that there's such a crisis of confidence, people won't enroll. And the very people we need to enroll, particularly our young people, to make this whole system work, won't happen. As you know, the people who are the most desperate, Senator Alexander's compelling story of Emily is the kind of person, serious health problems. But I'm looking for that 24-year-old working in Harbor East at a .com startup to be able to apply. Can you tell me what you're doing in terms of the crisis of confidence, but also how are we going to get young people back to looking at how they're going to apply to make it attractive, to give them confidence in the system, and also then to make the whole system more affordable?
So let me start with the affordability, and I will talk about both from the state-based exchange.
I have 2 minutes and 46 seconds.
Right.
So do you have a plan to get the young people back?
Yes, we do, and we will roll out that plan. Our goal is to stabilize the website this month, and then we do have a targeted plan that includes not only young people, but the large populations of the uninsured in markets. So yes, there is a plan.
Well, what kind of plan is it?
It's a combination of media, both television, radio, and some print. It's identified by top markets, and I'm happy to share that plan with you all.
And do you think you're going to restore the confidence in this plan?
Yes.
How?
I think, first of all, by the improvements in the website, which we're already seeing, and I would encourage folks, if they've not been on the website in the last few days, to please go on the website. It has improved. We're seeing more folks being able to complete applications. We're getting more positive feedback from individuals, and there is a tremendous amount of interest in this plan. Like I said, there's over 700,000 completed applications. Obviously, we've seen over 13 million visitors to the website. So the information's out there. We just need to ensure people that the site is working.
Well, I like to going to the website, which also goes to many of my rural constituents. We talk a lot about, of course, the robust Baltimore-Washington corridor, but not everybody has access to a computer, and not everybody knows how to use a computer, including young people. We worry in Maryland about the digital divide. Governor O'Malley, Ben Cardin, Barb Mikulski. But my question is, you say you can go to the phone. Are you publicizing this number? Number two, if you want a paper application or you want to be able to talk to someone in person, as you said, where do you go and where do you get this? And are there designated sites? In other words, will we do this in post offices? Will we do this in libraries? What are we going to do where people actually can be able to do this if they're not going to go to a computer or a computer is not available or their friend?
That is a great question. We do advertise the 1-800 number, and we advertise that you can call there to also get information if you don't want to use the computer. We also advertise who in the community. We have currently over 70,000 agent and brokers who've been trained to assist people. We have navigators in every state, and they are covering the entire state, so we advertise that. We also have many hospitals and other associations, including libraries, who've been certified and are offering to help.
Well, I'm going to be blunt because I really want this to be a success, and my job is to pinpoint solutions, not finger point it, looking in a retro way. I think it's very confusing. I know my time is up, but I think it's very confusing about where you go. We hear about the navigators and the this and that, but I can tell you, people really don't know. They really, really don't know.
Senator Isakson.
Thank you, Mr. Chairman. Administrator Davner, thank you very much for coming today. You said, I think, that 10 days ago, QSSI Quality Software Services was put in charge of coordinating the website and the hub. Is that right? Were you aware that in June of this year, the Inspector General issued the following report on QSSI that said Quality Software Services, Inc. did not sufficiently implement CMS-required information system security controls over USB ports and devices, thus risking exposure of personal identification information for over 6 million Medicare beneficiaries? Were you aware of that?
No, sir.
Okay, I'd like to put in the record the IG's report from June because it did expose it. Because of their lack of discipline in following federal information, they exposed over 6 million Medicare beneficiaries' information. And the reason I bring that up is, I don't believe everything I see on television. In fact, I try and check everything out. But this morning, what seemed to be a pretty credible claim that a lawyer in South Carolina who had gone on the website and gotten access and set up an account was called by a man from North Carolina telling him when he went up and put in his password, he got that man's information. So this information security is extremely important, and there's a lot of Mike Rogers in the House has made some pretty strong statements about the importance of keeping it secure. So I would ask that you follow the IG's report and make sure QSSI is in compliance, and if they aren't, they get in compliance.
Okay. I will follow up on that report, and there's two things. MITRE is actually the contractor who does the security of the marketplace, and we are working closely with them on this incident in South Carolina. We actually were made aware of that yesterday, and we implemented a software fix yesterday to fix that. That will be treated as a personal identification issue, and we will do a complete follow-up on that to make sure.
Well, you said in your testimony that this was going to be ongoing, because we all know cybersecurity is an ongoing challenge. But I think it's critically important to tell whoever you said the person in charge of security was to get with QSSI and make sure they've met compliance.
I'll make sure. I'll give you feedback.
Secondly, as one who was an independent contractor for 33 years and had about 1,000 independent contractors working for me, most of the people who were uninsured or had lack of access to good insurance were independent contractors because their employer could not by law provide it to them. But what the unintended consequence, yesterday I was with a group of them in Atlanta speaking to them, not about health care, but I had three come up to me, one of them Mrs. Russell, who had her own insurance that she had bought as an independent contractor, who had just received a cancellation notice, had tried to go to the website, couldn't, had called the toll-free number, and had gotten help from a human being who said they would send them the information, but they could not guarantee them when it would come. My point in this is when we passed the Affordable Care Act, it precluded insurance agents from being navigators and put in a medical loss ratio so high that you could not pay a commission to a salesperson. So the only access to human beings that could be incentivized to tell somebody what's in the plan was either to call the website, go on the website, or find a navigator. I really think CMS should consider in rethinking the prohibitions both on medical loss ratio and the unintended consequence of not allowing health insurance agents to be navigators, because that's limiting access of the American people to the information that you want them to have. That's just an editorial comment. My last statement, if you put up the chart on the iceberg, everybody thinks of Georgia, they think of Atlanta. But there's a lot more to Georgia than Atlanta, because a lot of our state is very rural, very agricultural. In southwest Georgia today, premiums are doubling. Premiums are, and more than doubling in many cases, and health insurance costs is going through the roof. When you said that the website was only the tip of the iceberg, you were right, because you have tremendous problems and tremendous challenges. But the biggest one of all are the premium increases to the people who can least afford them. And in rural southwestern Georgia, that is by far the case. So on behalf of those Georgians in my state, we're seeing a doubling of their premiums. And we need to address that, and we need to make sure that the unintended consequence of requiring so much coverage is not running people out of coverage rather than providing them with the coverage they need. Do you know what's contributing to the cost of rural health care going up so much in terms of the premiums?
So I would not be the expert there, but obviously the more competition we have, it tends to lower prices. And I find rural areas, I'm not familiar with Georgia, but I'm certainly familiar with Virginia, and that was part of the problem. There wasn't enough competition. The rates tended to be high. The rates were high prior to the implementation of the Affordable Care Act. We have seen new entrants into the market in most all states. So we're hoping that as these new entrants happen, it will continue to press the pricing downward, because competition does help.
Thank you for your testimony. My time's up. Thank you, Mr. Chairman.
Thank you, Senator Isaacson. Senator Murray.
Thank you, Mr. Chairman, and thank you, Administrator Tavenner, for being here and all the work you're putting into this. When we passed the Affordable Care Act, we really designed it to have states lead the way and drive market reforms by building their own marketplaces. States like Kentucky and my home state of Washington planned and designed and created their own marketplaces. And of course, many states declined the opportunity to build their own marketplace and relied on the federal government to do the work for them. Washington State's Health Plan Finder has been really a national leader on the launch of their new marketplaces, and in its first month enrolled nearly 55,000 people from my state for new health insurance coverage, including 10,000 kids. So I'm very proud of the work that's been done in my state to provide access to quality, affordable coverage. And I wanted to ask you to tell us a little bit about what you are seeing in the states like mine that develop their own marketplaces.
Well, you certainly listed some of the top. Certainly, I'll just list a few. All the states are working hard. You know, we have 17 partners at the state level, including D.C., and I would say that what we're seeing in Washington and Kentucky is probably some of the strongest performance, which is great. They have good systems. They've had lots of application interest. The other area that I would say we're pleased with, because of the size of the states, they're so important, is New York and California, where we're seeing good progress. But each of the states are moving along, and part of what we will be submitting in mid-November, as I've talked about in previous hearings, is some information about applications and enrollments that will look at the state and what's inside the state as well as the federal marketplace. So we'll have more data for you.
Good, and we're going to be using some of those states to use their best practices to help.
We are indeed. We have a meeting with them this Thursday. We meet with them regularly.
Good.
We have a good relationship.
Okay. And I also wanted to ask you about the next round of outreach to Americans and what it will look like. Everybody's focused a lot on the website, and we all know it's improving, and those will be solved. Those issues will be solved. But obviously, a lot of Americans were frustrated by their initial applications, and we've got them to get them to return to the site, the crisis of confidence that Senator Mikulski talked about. But in addition to those people, I want to know about the administration's plan to reach out to those Americans whose individually purchased plans are being canceled by their insurance companies. There was a story in our paper in Seattle about a 56-year-old woman who received one of those cancellation notices and who, like a lot of other people, was told to blame the Affordable Care Act in that letter. But of course she wasn't told that if she accessed the ACA marketplace, it could save her and her family thousands of dollars and provide her with upgraded, more comprehensive health care coverage. As I read her story, I thought that's an important reminder that it's going to be an uphill battle against some political and industry interest to get those individuals good information that have received those letters. And I wanted to know what you are doing to get information out to those people whose policies have been canceled that we've been hearing about.
This is actually a conversation we're having today about how do we use that. We have a consumer assistance program within CMS, within the CCIO component. Is there a way we can actively engage to reach out to people who have been canceled? Although they're canceled, they are offered another policy, but I think what's important for them to understand is it's not just that policy. It's also the ability to go on the exchange. As you mentioned in Washington State, they don't even have to apply. They can go take a look at what the rates are. You can now do that on the federal exchange as well. So we are working on a plan, and I'm happy to get back to you on that, but it will get back to you like this week.
Okay, I think that's really important because a lot of them are just seeing your policy's been canceled by Obamacare and not being told here is what your options are, and we've got to really work on that. So I appreciate that. Thank you, Mr. Chairman.
Thanks, Senator Murray. Senator Enzi.
Thank you, Mr. Chairman. I'm from a low-population state. We're pretty much rural, and we do recognize that the problems with the website are probably just the tip of the iceberg, much as this chart demonstrates back here. Saturday, 2,600 people in Wyoming had their policies canceled. Fortunately, 3 years ago, I noticed that the rules were changing and that people would not be able to keep what they had been promised. We have a method for petitioning on that. It's called the Congressional Review Act, and I petitioned, got enough signatures, and we had a little debate about repealing the rule that would have kept them from keeping the policy that they liked. That was voted down on straight party lines. I think some people will probably be paying for that in the next election. But I'm the accountant, so I'll go into some of the more technical questions with this website. It's my understanding that CGI's contract is a cost-plus contract, where the company will continue to be paid for its work while they try to straighten out problems that maybe they even caused. How much more will it cost to fix the website, and where will these funds come from? Also, if it's their fault for delivering a product that didn't meet specifications, do you intend to recover payments for them, and what recourse is available?
You are correct. The CGI contract is a cost-plus contract. First of all, there is not additional funding being provided to CGI. They will work and make these repairs within the existing contract. I meet regularly with not only CGI Federal, but also CGI Global to have these conversations, including one at 8:30 this morning. So the work is expected to be completed. There are recovery process even in a cost-plus contract, and I'll have to get you that information. I would not want to rely on my brain for that one, but I will work with our contracting person.
I'd like to be able to get a copy of the contract as well, and then there must be a contract with QSSI as well.
Yes.
Is that a cost-plus one as well?
I will have to get you the details on the QSSI, but I thought we not provided contract. Yeah. And we can certainly get you the information you requested.
Is CGI, where is CGI headquartered?
Headquartered CGI is actually in Virginia.
Okay. And QSSI?
Well, that's a good question. Minnesota? I'm guessing on that one because it's part of Optum.
Okay.
They have also offices in Virginia. We're working currently with both the national and local. They're in Virginia, and they're also in Maryland.
I also serve on the Finance Committee, and in the Finance Committee, CMS testified on doing the testing on this website. We were assured that it had all been done. It's my understanding that there was testing still going on the day before the website opened, and that there had not been the security testing that either was called for or wasn't called for to see that the website would be secure and intact. How much security testing was done as part of the beta testing?
So I think this is what I was trying to explain earlier. There are two components to the Federal Exchange. One is the hub, and the hub was completely tested, security testing, signed off. In the case of the FFM, or the actual exchange itself, each component was tested, both by us, independently verified, security tested. It was not signed off in complete package because we were still upgrading modules, so that's ongoing. So we signed a short-term authorization to operate, which would be customary if you were continuing to do work on the project.
You also mentioned that this information that goes in there is just pinged and it's not stored. How do you identify the person later when, with whatever contract that there is, if there isn't any of that information kept?
So what I'm saying is not stored is the Social Security number and this sort of thing is not stored in the data hub. Obviously, when you complete an application, it has Social Security number information in it, and that's individual can store that online. That's part of the ID proofing that an individual can do to store their application. We also have some storage in what I'll call the enrollment and eligibility process in case there's an appeal or this sort of thing. But I think what I was trying to say is there's no data stored in the hub. We obviously have information and personal records.
I don't think people care where it's stored. They're just concerned about their privacy and whether the storage is secure or not. So I'll have some more questions to follow up on that, but my time's almost up. Thank you.
Thank you, Senator. Senator Bennett.
Thank you, Mr. Chairman. Thank you, Ms. Tabner, for being here today. As I've watched this, and I've had some experience in the private sector and in local government and state level and here, I hope as we go forward we don't lose sight of the fact that government does not do a great job with procurement, with IT, or with customer service. And I think we're seeing that here in spades. And my hope is that we use this as an occasion not just to point fingers, but figure out how to improve things for the American people going forward. In the short term, I think the customer service element of this is enormously important so we don't face the kind of crisis of confidence that Senator Mikulski talked about. That ought to be job number one, to figure out whether people, put the politics aside, whether people sitting at their kitchen table can decide and evaluate for themselves whether this is a better deal or not for them. And in Colorado, as you know, we've set up our own exchange. One of the things that I've been told is that people have to go through 20 pages to have a determination made about their Medicaid eligibility before they can actually get access to the private marketplace. And there's been some suggestion that that's been required by the federal government. I don't know whether that's true or not, but I wonder whether you can enlighten me on that or shed some light on it, and whether we could figure out how to work together to make that less a burden to people, because it seems to me that a customer service friendly website would have a button that said, if you think you might be eligible for Medicaid, click here, take me through that. But for somebody who knows they're not eligible, to skip the 20 pages means they get to the private exchange.
So I think
And I'm sorry, as you talk about that, Ms. Tabner, if you could broadly address the question of the sort of customer service part of this, the changes that you have made to try to give people the opportunity on the federal exchange to make their own decision.
Right. Let me start by saying it is a common application, whether you're going on to shop without a subsidy or to see if you qualify for a subsidy, or for Medicaid. And I think that's what you're referring to. It's a common application. But whether you are Medicaid eligible or whether you are applying for subsidy, it's a single application. So Medicaid doesn't add any additional steps to that process.
My understanding is that and again, this is the Colorado exchange,
right,
not the federal. My understanding is that you need to be denied by Medicaid before you can have access to shop in the private marketplace.
So I would need to check with Colorado because they did devise, but I'll get back to you.
Okay, let's do that. Good.
So let's go back to the customers.
Can we do that today?
Yes.
Okay,
I can get you
great.
that information.
Thank
today.
you.
The customer service issue is very important to us. And as we stabilize the site, we're going to go back and deal with those individuals that we think may have had a bad experience on the front end, such as the establishing of the email account. We have individuals' information, so we're going to reach back out to them and invite them to come back. Now, some of them may have already gone ahead and created a separate account, or maybe they were just on there out of curiosity, but at least we'll make an effort to go back and touch individuals and say, if you had trouble in the first week, please come back and try to establish your account again, because we've solved that problem. So that's the first step. The second step is how we handle it in the media and in the market. And so we do have, what I was talking about before, a campaign to reach out to consumers, but we will not start that campaign until we stabilize the site over the next few weeks, and then we will spend December, January, February, and March reaching out to individuals. If you're in a state-based exchange, the state is responsible for doing their own marketing campaign. If you're in the federal exchange, we have that opportunity, and so we've identified key markets based on the number of young uninsured, the number of uninsured in general, and the population. So we do have a targeted campaign for the next 4 months.
What are the implications for your timelines with respect to eligibility, sign up, and all the rest, if you don't get this website fully functional by the end of the month, or by the end of this
end
month?
of November. So based on our analysis, we will have it fully functioning by the end of November. There will always be people who don't want to use the website, who want to do paper, who want to call in. That's fine. We'll support that. But I think we always assumed that, based on Massachusetts experience, that the initial sign-up would be very slow. And in fact, no payments have to be made until December 15th for coverage on January 1. So while we don't like the problems we had in October and fixing it in November, we do not think it will impact the timeline, because we have a 6-month enrollment, so we'll still have 4 months left, and individuals can apply up until the end of March.
Thank you. Thank you, Mr. Chairman.
Senator Bennett, and now Senator Roberts. Senator Roberts.
Thank you, Mr. Chairman. I'm going to focus, if I can, on the concern raised by Senator Isaacson and Senator Alexander and by the chairman on security and privacy. We have a law, the Federal Information Security Management Act, FISMA. Everything has to have an acronym. This is FISMA. And it requires each agency to appoint a chief security officer to sign off on the security of government web systems to ensure Americans' private financial and identifying information is protected, and that's a big issue. Secretary Spias revealed last week that the exchange is operating on a temporary authority to operate. There's a 2012 memo from Jeffrey Zients. Now, that's the gentleman that has been picked by the President to fix the Affordable Health Care Act, and they call him Mr. Fix-It. While head of OMB, he stated clearly that OMB does not recognize interim authority to operate for security authorizations. My first question is, why was the exchange allowed to go operational without the apparent clearance required by the Office of Management and Budget?
So
I'm going to go on and just, think about that a minute, and I don't like to do this, but, time is limited. Again, as part of the FSMA security assessment, an independent testing organization must perform a risk analysis of the security of the system. So my second question, and you can answer the first, did an independent testing organization ever test the whole integrated system end to end? I'm sorry to ask you two questions.
That's all right. The first question, OMB does approve of short-term authorization, so we were following the rules as outlined by OMB, and I double-checked that. The second one is, yes, we are FSMA and NIST compliant, and we did use an independent security firm. That would be MITRE, who actually did the work and did the testing. And the only piece that was not complete, which is the piece I've talked about before, is we could not test in a live environment until October 1, which is the reason we went with the short-term authority, because the testing will continue this month and next month as we do the software upgrades, and it'll be tested in a live environment.
Well, without revealing publicly, which obviously you can't do due to what you've just said, will you submit confidentially to the committee the results of the independent testing?
I will submit everything I can within the security guidelines, yes, sir.
All right. A September 27 memo addressed to you states that due to system readiness issues, the required security assessment was only partly completed. The memo notes that untested parts of the system pose a high security risk, and the contractor was not able to test all parts of the system in one complete version of the system. I have here a CBS News analysis, which I would like to include in the record at this point, and that found that the deadline for final security plans slipped 3 times, from May 6 to July 16. Security assessments to be finished June 7 slid to August 16, then August 23. The final required top-to-bottom security test never got done. Agency head Marilyn Tavenner, according to this analysis, accepted the risk and mitigation measures like frequent testing and a dedicated security team, but 3 other officials signed a statement saying that does not reduce the risk of launching as of October 1. That September 27 memo recommends a mitigation plan to address these risks and recommends a 6 months authority to operate. That recommendation was signed by you. Are you the official at CMS responsible for making the security authorization decisions?
So I think in the case, because of the visibility of the exchange, the Chief Information Officer wanted to make me aware of it, and I agreed to sign it with their recommendation to proceed.
Does anybody else review or approve that decision before it's final?
No, sir.
Like Secretary Sebelius? Or?
No, sir. That was my decision.
I appreciate that. Thank you very much.
I'll take the remaining 30 seconds of the Senator's time to just say again, I think as I talk to my fellow Senators on both sides of the aisle, this is a paramount concern. Consumers have to be absolutely certain that when they go on and they fill out that application, they give all that information, that is secure, that no one can hack into that and steal their Social Security numbers, their identity, and other things. And so I just think this is an issue that really has to really be focused on thoroughly, so that there's absolute assurance that is secure. Thank you. Now,
Mr. Chairman, could I get my 30 seconds back?
Well, you gave it up already.
Well, no, you took it.
Well, I did.
I just sort of gave it up. I'd just like to reflect on what you said, sir. There's a lady named Margaret from Manhattan, Kansas, who I promised that I would bring this issue up. She tried to get on, she tried to get on the exchange, and then she tried the call number about 3, 6, 7, 8 times. Finally got somebody, and then she said, "Well, if I selected that plan, would it be, would it be secure?" And the answer was, "Well, pretty sure." That's a direct quote. And she said, "Well, if you're pretty sure, I want to be sure," and hung up. and called our office. So that's just an example of the concern that you've raised.
I appreciate that. I do share that concern. Senator Warren, Senator Hagan, Senator Baldwin.
Thank you, Mr. Chairman. I want to thank you and the ranking member for convening us today, and Administrator Tabner, thank you for being here. Mr. Chairman, I appreciated your opening remarks and sort of setting a context for where we are with real and significant challenges, but also a story of the earlier implementation of the Affordable Care Act that has proven to help very many. I think about the parents of children with pre-existing health conditions who can now secure insurance for their children and the peace of mind that provides. I think about the 6.6 million young adults who are covered on their parents' health insurance, and I take personal pride in that because I worked on that amendment as a House member when we were marking this bill up in Energy and Commerce. I think about the $6 billion in prescription drug savings that seniors have had the advantage of since the passage of this bill. And then I think about the rough implementation of this next phase of the Affordable Care Act. And even with the significant technical issues around the website, healthcare.gov, I've heard from families in Wisconsin that are already recognizing some of the new insurance options that are available. And as you said in context in your opening remarks, that's what this is about, is a new marketplace, especially for those who are shut out. I heard from Carl and Bonnie, who own a farm in Hayward, Wisconsin, which is in the north woods of our state. And they shared about their struggle to find health insurance prior to the passage of the Affordable Care Act. They were both dropped from their plan after health tests showed that Carl was at risk of developing prostate cancer. They had to buy a new plan. They were lucky they could find one that had a $10,000 deductible, an $800 premium, but it had a rider that said it would not cover prostate cancer if Carl ever got sick. But due to the Affordable Care Act, they are now comparing and shopping for new coverage in the marketplace, and they contacted me to share that they are thankful and really excited to be able to find health care plans that are not only affordable but actually cover cancer. Given the quality health insurance options available on the marketplace, we need all of the doors to that marketplace to be wide open. And the ongoing technical problems are unacceptable, and they must be fixed as soon as possible. And I'm glad to hear your update on the progress. They should have been fixed yesterday. But the need for a well-functioning healthcare.gov is particularly acute in a state like the one that I represent, because our governor chose not to build a Wisconsin-made, state-based health insurance marketplace for individuals and small businesses. He also failed to seize the opportunity that the Affordable Care Act presented to strengthen what we call Badger Care in Wisconsin when he decided not to expand Medicaid under the Affordable Care Act. Instead, Governor Walker decided to kick off as many as what we think will be around 90 to 92,000 people off their current Medicaid coverage. And I think about all our discussion about if you like your health care plan, you can keep it. Well, there's tens of thousands of Wisconsinites who like their Badger Care. And the reason that they can't keep it is because of our governor's decision. I wanted to ask you, Administrator Tavenner, to start off, can you confirm that Wisconsin is one of the only states in the nation that's poised to kick off a large number of individuals from their current Medicaid coverage in 2014?
Senator Baldwin, right now, and we are in discussions with Wisconsin, they and Maine are the two states that are looking at this idea. Other states have talked about it, but these are the two that have actually put proposals forward. And you're right, it is 92,000 people. And we are working with Wisconsin, our Medicaid agency, to try to make sure that those individuals are at least aware of the marketplace for those that would qualify for the marketplace.
And I want to ask you a little bit more about that, because this is a significant number of people in my state. And in order to avoid a lapse in coverage, individuals losing Badger Care must enroll by December 15th in
I'm sorry,
the
the
Federal
senator's
Exchange.
time is...
Oh.
I'm trying to hold everyone to 5 minutes. Everyone's been
Very good.
very good about this. Senator Scott.
I wanted her to continue to talk to get more time from my side.
What?
I wanted her to continue so I'd have more time.
No, we're trying to keep it 5 minutes. We'll get a second round. Everybody will get a second round.
Republican jokes aren't funny. I'm sorry. I apologize. Thank you, Mr. Chairman. Southern drawl. Anyways, let's get back to the topic here. Ms. Tavener, thank you very much for being here. We are now more than 30 days into one of the greatest website disasters in history. After nearly $400 million, healthcare.gov is synonymous now with failure. The public's trust has been broken, and the reports I'm hearing reinforces why. One in particular, we've already heard discussion on this case of the South Carolina man, is so painful that I want to dedicate my time and my questions to trying to resolve his issues. The case starts with Justin Hadley from North Carolina attempting on October the 1st to get Obamacare through the healthcare.gov. By Halloween, just 4 or 5 days ago, he was still unable to sign up for Obamacare. However, Mr. Hadley from North Carolina immediately saw 2 download links. The link document was an eligibility notice to Mr. Dougal from South Carolina, including Mr. Dougal's name, his address, and his eligibility for subsidies. Mr. Dougal is now requesting that the personal information for all of his family be removed from healthcare.gov because he cannot remove it himself because there's no delete option for consumers. Of course, now Mr. Dougal nor Mr. Hadley will use the website to purchase insurance. Making matters worse, when my office was contacted for assistance, we called the healthcare.gov's 800 number as well, and we asked a very specific question. Can you remove Mr. Dougal's personal information? The response was silence. Not a yes, not a no, not a maybe, not let me check with my supervisor. They just simply refused to have an audible word in response to our question. It's hard to believe that your account managers really do not know if they can delete accounts internally, especially after such an egregious breach of trust. By the way, Mr. Dougal has called on several occasions, but no one will call him back. Not a single person has taken the time, after having his information exposed, to even call Mr. Dougal back. I tell you this story because it illustrates what happened as a result of incompetence with this website and this program. The administration and HHS knew that Americans' personal information was at risk before the website went up. I think Senator Roberts just spoke about the Inspector General's report from August that warned that Obamacare's exchanges may end up illegally exposing Americans' private records to hackers and criminals. The report noted that CMS is working with a very tight deadline to ensure that security measures for the hub are assessed, tested, and implemented. Further, Senator Roberts alluded to the internal memo from September 27th obtained by Washington Post. And to quote that memo, it says, "Inherent security risks expose a level of uncertainty that can be deemed as a high risk to personal financial information being exposed." The memo was, of course, as you have taken responsibility, and we do appreciate that, was written specifically to you from your consortium administrator for health plan operations and the deputy CIO. You signed the authority for healthcare.gov to operate for the next 6 months with a mitigation plan to be implemented. In other words, you authorized healthcare.gov to go forward, realizing that the potential of exposing personal information was, and I quote from the memo, a high risk. Here are my questions. Do you believe that 6 months is an acceptable amount of time for this website to operate in a manner that puts Americans' financial information at high risk for security breach. Has this happened before? Can you guarantee that Social Security numbers, and it seems like you've addressed this, are secure? Will you shut down the website, as my friends from the left have already suggested, until security issues are fixed? I would also like to finish by asking that we get Mr. Dougal an answer as it relates to deleting his information from the system, and that we get that answer today if possible. I have a copy of the letter that he is requesting, and I would like for Catherine to bring the information over to your staffer as well. And I certainly realize at the beginning of this testimony, the answer was given that the software fix has happened on this information, but the software fix was simply to disable the links. So when Mr. Hadley goes back on the website, he still sees the links. He simply cannot click the links. So the guarantee or the clarification or the resolution that simply tells Mr. Dougal that he has complete confidence that his information has been deleted from the system has yet not been achieved.
So first of all, Senator Scott, we have reached out to Mr. Dougal several times, and we will find him and we will follow up on his question.
I'm happy to give you his phone numbers.
I think we have them. Thank you, though.
He doesn't think so, actually.
Oh.
Because no one's called him.
Well, we have disagreement there.
Yes, ma'am.
Your second question about the hub is the hub was, and this is, I keep trying to separate the two because they are two different systems. The hub was completely tested all the way through, and there was a sign-off by the Chief Information Officer, so we should put the hub aside. What we're actually talking about is the FFM, or the exchange piece, and that's the part that I described. And in the 6-month period, let me tell you what's going on at that site. There's a dedicated security team that works under the Chief Information Officer. We do weekly testing of all border devices, including internet-facing web servers. We do daily, weekly, 24/7 continuous scans. We will have a full SSA test in a stable environment with all the security controls once the software upgrade is done, and that's standard operating procedure. And that will be within 60 to 90 days of us going live on October 1.
My only response, and my time is up, thank you very much for your answers. I would only suggest that whether it's the hub or the other entity, the thing that the consumer sees is not what's going wrong. It's that their confidence is going down, and we're only trying to make sure that we alert y'all to the fact that if any aspect of it doesn't work, then the confidence is gone. Thank you, Senator.
Senator Scott, I wonder if you would also make that what you gave her available to the minority and majority staff directors.
Yes, sir.
Of the committee. I'd appreciate that.
Yes, sir.
Thank you. Thank you. Senator Murphy.
Thank you very much, Mr. Chairman. Welcome, Ms. Tavenner. Listen, I will concede that when you reorder 1/6 of the American economy, there are going to be some people who are unhappy with that experience. And I also concede that when you stand up a brand new mechanism to give 30 million people access to health care that they didn't have, that there are also going to be some people that are unhappy with their experience. And I think at some level this should be an exercise in setting the right expectations, that when you undergo this kind of effort to reorder a healthcare system that everyone on this committee agrees is broken, there are going to be some people who win, and there are going to be some people who lose. And frankly, under any reform plan that has been debated in this place over the last 20 years, that was true. What we are suggesting is that there are going to be far more people over the course of the rollout of this legislation who have a better experience than what is happening currently in our system, than have a worse experience. And while it's always risky to legislate by anecdote, we're telling stories here today. And so let me just add one to the mix, and that's Betty Berger from Meriden, Connecticut. Betty and her family had insurance. Her husband switched jobs, and during the several-week period in between his first job and his second job, their son was diagnosed with cancer. And guess what? His new employer wouldn't pick up coverage for the son. And Betty's story became one that can be repeated 2 million times every single year across this country. They went bankrupt. they lost their house, they lost their car, they lost their savings simply because their son had the misfortune to be diagnosed during a 2-week period in which they didn't have insurance. Their problem wasn't that they got dropped from coverage. Their problem was that they couldn't find any coverage, and their story can be told millions of times over. And I guess my confidence that in the end, well, this is a disruption to a large section of the economy, my confidence that in the end there are going to be far, far more winners than losers is rooted in part in Connecticut's experience. We have an exchange that is up and working, and in the first month of the exchange, we have hit 10% of our overall enrollment goal, even given the fact that the Massachusetts connector, which was actually run by the same guy who's running Connecticut's exchange, in the first month only saw 0.3% of their total enrollees sign up. And so I have confidence that this product will fly off the shelves once people can get into the website, because I've seen what is happening in Connecticut. And I also am optimistic that once this site is up, it is going to be up in time for the largest number of people to enroll, because as you said in response to Senator Bennett's questions, the reality is that the vast majority of people are going to be looking for coverage as the enrollment date draws near. So I guess that's the frame of my question to you, is from the experience of people who have been able to access these exchanges, either at the national level or the state level, what do we know about the quality of the product? And two, what do we know about the timing of when people actually sign up for plans like this? We have the Massachusetts experience. We have the experience of Medicare Part D. To the extent that your timeline plays out and we have a fully functioning website within the next 30 to 60 days, is that in time for what we expect to be the majority of people coming in and wanting to access the product?
So let me start with the product. I think that we are extremely pleased with the product, and I think it's important not to lose sight of that. As I said before, we had about 25% new entrants into the market, new issuers offering new plans. We had over 200 issuers and over, I think it was close to 3,000 products, but I'll get you that specific information. A lot of interest. The insurance market wants this to succeed. They see it as a new line of business. So we've been pleased with the states and the competition. Now, there are some rural exceptions, as we've talked about before, and we want to stimulate that as time goes on. The second piece, we have always believed that the first enrollment surge would come mid-December, and the second enrollment surge would come late February, early March. That there would be people who'd want to sign up by January 1, but that there would always be another group who would wait until the last minute to sign up. These presumably were the younger, the healthier folks who would wait until it became an issue for them. So that's what we believe. The product is very strong. We would like to see more competition. That will occur year to year. This is our first year in the market. But we have been pleased, and in fact, the pricing came in about 18% below what CBO estimates were. And we would like more introduction in some markets for sure, but it was a good year one start for us.
Thank you, Mr. Chairman.
Thank you, Senator. Senator Burr.
Administrator Tavener, welcome. Last week during your time in the House, you noted that while many insurance companies have decided to cancel or stop offering insurance plans on the individual market, the ACA did not force insurers to make such decisions. You stated, and I quote, "The issuer has decided to change the plan. It didn't have to."
I'll give you a signal.
And that plans were grandfathered in 2010. If they didn't make significant changes in cost sharing, they could keep the plans they had. Do you believe that that was an accurate statement you made?
Yes, I believe that was an accurate statement. When we did the regulation back in 2010, this is what plans could change.
Let me read your statement again.
Well,
the ACA did not force insurers to make such decisions. I quote it, "The insurer has decided to change the plan. It didn't have to."
And I will stick by my statement.
Okay, let me
can I finish my sentence?
Well, let me just say, you said today, and I quote, "Insurers that do not cut benefits or increased cost sharing.
So I will try to list that out. They were allowed under regulation to make modest changes to benefits, modest increases in fixed dollar co-payments and deductibles if health care costs increased. In other words, if health care costs went up, they could move up. They could modify their provider networks. They could update drug formularies. They could change the plan structure to add features like health reimbursement accounts. So yes, there was some room if they wanted to stay.
For an insurance product that didn't meet the minimum coverage benefit that was established under the ACA, they can't offer that insurance product, can they?
They could be grandfathered in under this, yes.
But the decisions that are made, if they don't meet the minimum benefit that was established under the ACA, that is an individual that will have a plan canceled. Is that not correct?
No, what I'm saying is they could continue these plans. These plans could be grandfathered in. It's if they made these kinds of changes, if they started to reduce benefits, then they fell under the requirements of the ACA. So they could stay in these policies.
Did you personally share with the Secretary that there were problems with the exchange?
I personally shared with the Secretary in September that there were modules that we were going to delay: SHOP, Medicaid account transfer, Spanish version.
We've had a lot of conversations on security. Let me ask you very specifically, and this is on the exchange, it's not on the hub. Was there ever any end-to-end testing on the exchange?
There was end-to-end testing on the hub.
I'm talking
There
about the
was individual modular testing and demonstration testing inside the exchange, meaning we had sample cases, sample situations that we tested all the way through. We obviously could not test live until we went live, therefore the temporary authorization.
But one of the requirements is end-to-end testing. But again, you signed on September 27th the authority to operate the website. And the memo noted this, and I quote, "From a security perspective, the aspects of the system that were not tested due to the ongoing development exposed a level of uncertainty that can be deemed as a high risk for federally facilitated marketplace systems." Did you bring that security concern to the Secretary's attention and to OMB's attention?
I did not.
Okay. Secretary Sebelius said last week that the implementation took place on October 1 because that was the law. Now, let me ask you, I've read the act several times. My interpretation is that Secretary Sebelius had the authority not to execute that on October 1. And clearly my interpretation, if you had not signed the authority to operate the website, it would not have stood up on October 1. Are my two statements accurate?
I don't know that your statements are accurate. The law says that January 1 is when individuals have to have coverage. We put a reg in place that said October 1 would be the day we would start so that people would have time to sign up. We declared the 6-month enrollment window.
Do you think that the Secretary had the authority to waive the October 1 reg?
I do not know the answer to that question.
Is it true that individuals who were enrolled in the health plan after March 23, 2010 are not eligible for grandfathered plans?
Ask me that question again.
Is it true that individuals who enrolled in health care plans after March 23, 2010 are not eligible for grandfathered plans?
That is true.
Do you think personally that Americans should, last question, do you think Americans should have the ability to keep their plan?
I think individuals, as we talked about, in the grandfathered plan, we allowed that to happen. And in large employer plans were grandfathered as well. So I think we tried to look after those individuals through that grandfathering.
Thank you, Mr. Chairman.
Thanks, Senator Estes. Senator Franken. Senator Franken, yes.
Thank you, Mr. Chairman, for convening this hearing. Ms. Tabner, like my colleagues, I'm frustrated and disappointed that a month into the open enrollment, there's still problems with the federal marketplace. I appreciate your being here today. I think it's important that we understand what you're doing to fix the problems that have hindered comparison shopping and enrollment over the past month, my number one priority is to see to it that Minnesotans have access to our state-run marketplace, that access is protected. Things seem to be going better with MNsure, that's Minnesota's health insurance marketplace, than with healthcare.gov, and it's been going better in a lot of states. MNsure is reporting that thousands of individuals and families are completing applications for comprehensive affordable health coverage. Although MNsure was developed and operated by Minnesota, it does rely on the federal hub for its eligibility determinations, and this is a problem we had very early on, getting people to be verified. And also, when the hub is taken offline, MNsure must also go offline. What are you doing to make sure that Minnesotans can continue to enroll in health plans through MNsure, our state-run marketplace, while Healthcare.gov is undergoing maintenance?
So in the case of the hub, there's been very little downtime of the hub itself. We do have a window from 1 a.m. to 5 a.m. That we had agreed to prior to ever going live with the system, that there are certain components such as Social Security, which is not active during that time. That's the routine maintenance for Social Security. But the hub has actually worked flawlessly. So it has not been the issue, and certainly the Minnesota state-based exchange is doing well, and they have access to the hub. When we are going to schedule downtime of the hub for maintenance or other reasons, we let states know ahead of time so that they can plan accordingly and put up appropriate signage on their sites.
But the hub didn't work flawlessly the first week.
I think the hub was not the problem. I think we had a problem with email accounts being established at the federal level, and that was fixed. And I think Minnesota had some problems, too, as it related to account development. But I think those are all behind us. They were not hub issues.
Okay. Well, anyway, MNsure is almost entirely separate from healthcare.gov.
Right. It's used the hub.
And I believe it's been working a lot better. However, one of the critical elements of success for the state-run marketplaces will be clear communications with CMS about problems like those that MNsure saw in the first few days with the federal website. Do you have open lines of communications with the states that are operating their own marketplaces about the challenges that they're facing interacting with healthcare.gov?
We certainly do. We have regular, almost daily communications with states, and we have teams assigned to work with states. And then we, every week or two, do either a video conference or calls with states. We've also had them in for meetings. So yes, we have very open lines of communication with states.
There's been a number of questions about the security of private information, and I'm chairman of the Judiciary Committee on Privacy, Technology, and the Law, and I spend a lot of time working on protecting consumer privacy, and this is very concerning to me. Can you tell me what you're doing now to make sure that consumers' health information is securely protected?
As I talked about earlier, we're meeting all the FSMA standards. We do continuous security testing, and I kind of walk through those. We do have a dedicated security team. We also do independent security analysis, so it is continuous. We treat the marketplace the same way we would treat Medicare or any other system. These systems are inherently high risk, and I think that's important. Every quarter, I'm doing reports to the GAO and others about the high risk of the nature of these systems. So we treat it as a high-risk system. We monitor it continuously, and we have a team dedicated to report on it and make us aware of things right away.
Okay. My time has expired. Thank you, Mr. Chairman.
Thank you, Senator. Senator Kirk.
I have two questions to what I think we see here as a tale of two Beltway bandits, QSSI and CGI. QSSI and CGI to mainly build what you have. Who is the CEO of CGI?
Of CGI Federal?
CGI Federal.
Yes.
It's the appropriately named
George
Michael Roach.
Schindler. And Michael Roach is the CEO of CGI Global, and I'm in close communication with both.
My guess is you, from what information we have, you have provided upwards of $400 million to Michael Roach to do this work?
So I think current spending to date, the $400 million includes CGI, it includes QSSI, and it includes other
Could you
vendors.
provide the committee with a copy
Certainly
of the contract?
can. Certainly.
Good. We'd like to. Why do it in such a sneaky way? Why refuse to provide the contract to Congress? You know, I'm from Chicago, where we always kind of follow the money, and if I can't find out where it went,
I'm happy to go back and check. I thought a lot of information had been provided to Congress, but I'm happy to
So
check.
you will be able to provide the contract with CGI to us?
So I will get you everything I can, yes. I thought that had already been shared, so.
Good. Don't you have money missing that has not been paid to CGI? My understanding is about $100 million to go. After a disaster of this nature, is there a way to have some accountability here with the remaining funds?
And I will get,
and not give it to Michael Roach?
yes, I will get back to you with that information.
Yeah, maybe he can skip a holiday in the Bahamas. Yeah. So, thank you. I will go line because it appears you're going to inflict CGI on the people of Illinois, where credible media reports tell us about upwards of 30,000 citizens of Illinois might lose their health insurance because of this program. I think the AP just ran a story about 3.5 million Americans will lose their health care because of this program. How much have you...
I'm not sure that that's accurate. I think you're referring to canceled policies, but they were canceled old policies. They were offered new policies. They can also shop on the exchange.
I'm referring to the AP story.
I don't know which AP story, but there are not 3 million people losing coverage.
Are you accountable for the taxpayers' funds?
I certainly think I am.
Yeah, you are. Hundreds of millions of dollars. I would say for Michael Roach, I would think that you have provided a substantial wealth to him. I would just point out, I think we ought to know the full details of the contract that you signed with him.
So unless I'm wrong, I think you have statements of work. You have a lot of information already, but I'll get you anything else that you think you want.
Only thing, I'll go to the other CEO of QSSI is Bikram Bakashi that you have been paying money to. So how much I was just thinking of a phone call that might have happened when you were getting ready for this hearing. Hey Bikram, it's Carolyn, Whiskey Tango Foxtrot on my website, as we would say in the Navy.
What?
WTF, yeah. See, be like that. Yeah. Just after hundreds of millions of dollars, you should have something. I would just wonder what Mr. Roach is driving right now. Probably something really nice after the amount of money you've given to him. All right, Mr. Chairman, I yield back. Let Carolyn
Thank you.
know.
All right. Let's see, Senator.
Yeah.
Senator Hagan.
Thank you, Mr. Chairman. Thank you, Mr. Taverner, for being here. Let me just ask about the December contingency planning. At the end of this month, either one or two things is going to be true. Either the website is going to be working smoothly for the vast majority of its users, or it won't. And in both cases, the administration is going to have to take quick action to ensure that individuals across the country are being treated fairly. So, and I'm sure people are planning for this at the end of the month. Since the plans for since it failed, but if the site works, then individuals will just have 2 weeks to really shop and enroll in a plan that will take effect on January 1st. Is the administration planning an education and outreach strategy to match this tech surge that's currently underway? And if the site is not working, then what steps is the administration going to take, including delaying the penalty for not buying the insurance? And then what are they going to do to help individuals to be sure there's not going to be a gap in their insurance coverage?
So, yes, there is a press or public campaign that will match the end of November and going into December, January, February, and March. There are no plans to delay the individual mandate.
So what if the site is not working?
So the site will be working. The site's working now. What we're doing now is making performance improvements, but the site will be working.
And are enough people able to get on the site?
Yes.
Do you have numbers?
So I already said earlier that we had over 700,000 who have completed applications, and we will have numbers mid-November for October in more detail, which I think is what you're asking.
Okay. You know, I have called for extending the open enrollment period and then waiving penalties for not buying the insurance for 2 months to make up for time for the lost time that it's taking getting the site up and working. So I think that's going to continue to be an issue that's out there. You know, one of the things that I was concerned about in reading the material was the contract to award the site for the management. Was it really awarded to companies that had bid on an IT contract that was back in '07?
Yes.
Was it not open to other companies?
It was actually what's called an IDIR contract, which back in 2007 there were a list of IT vendors to do this kind of work.
But a lot has changed since '07 to 2011 or 12.
So I think this is more around the process. These are certainly current IT vendors. But yes, the process was the IDIR.
So you're saying, too, it was back in if you weren't on that contract in '07, would you not be eligible to bid?
Yes, that's correct. You would not be eligible. The IDIR process was completed in 2007. It's been used for IT projects inside CMS. It's a series of contractors who've been pre-screened, pre-qualified. They still go through a competitive bid process, but it's limited to the individuals who qualified in 2007.
For the tech surge that's just started recently, are those companies, would they have been on that '07 qualified contractors?
I would have to look at the individuals inside the tech surge. Certainly some of the contractors that you would have seen on that list are common in the IT space, so it would not be unusual.
Okay. On September the 30th, the night before the site was set to launch, what were your expectations for the launch day?
So, it's a great question. My first expectation is that we would go live shortly after midnight, because we were doing a soft launch at midnight with the idea, and we had pretty much promoted that the site would go live at 8 a.m. the morning of October 1st. So we went live shortly after midnight. We had tremendous interest, even during the night. And my expectation was that the site would work. It would have its customary glitches of a new site. It's a complicated website. So I think we knew all along it would have bugs that would have to be handled. We also knew all along that we had pulled certain functionality out in order to spend more time concentrating on the application process. Those are the ones we've talked about publicly: SHOP, Spanish, Medicaid account transfers. So what I expected was a site that worked with some issues. What we saw is more volume than we had anticipated, and we anticipated pretty high volume. And then we ran into the issue with the establishment of the email accounts right away, so then we had a problem solved for that. So those were two things we did not expect.
It seemed like the information that I have been reading was that there was warning before the site was to open, and that there was a lot of concern that testing had not been done. And that I think, in hindsight now, a lot of people are saying, why didn't the administration and the CMS give more forewarning about the site not living up to the expectations that was being called for, and that was, many people understood that it would be up and running and being able to access it quite easily.
So I would say that the testing, again, around the hub was complete. I think the testing that had not been finished was the testing in a live environment with real individuals, which we couldn't do till after October 1. But in our analysis and in our modular testing throughout the FFM, we had done independent verification. It had passed security checks. So we were comfortable, and we did not have any high-risk recommendations in any of those components. We just could not do the live end-to-end testing until October 1 when we actually signed up. We did case testing prior to that.
Thank you very much, Senator.
Thank you.
I wasn't watching my clock. I went over, and I apologize. Senator Murkowski.
Thank you, Mr. Chairman. Ms. Tavener, thank you for joining us in committee today. I want to talk about Alaska. I had a meeting just about 10 days or so ago with the navigators that are trying to help facilitate the exchanges in Alaska, as well as Enroll Alaska, which is an insurance broker that has been set up specifically for this. These are all folks that want this to work. What I heard from them was, stop. It's not working. As of the 29th of October, Enroll Alaska confirmed that there were exactly 3 Alaskans that had successfully enrolled. There is nobody else that has confirmed that they have successfully enrolled in the exchange from Alaska. Now, this is the 5th. We may have had somebody come in yesterday, but as best I can tell, it's 3. In a letter that I received from Enroll Alaska, they confirm this, and they have specifically asked that the administration pull the website down, rebuild it, and redeploy it. Again, these are the folks that really want this exchange process to work. One thing that was very disconcerting in that meeting was to learn that perhaps the 3 that have been enrolled have been given incorrect information, because it has been discovered that the FFM was calculating the subsidy for Alaskans incorrectly. Therefore, Enroll Alaska has suspended all enrollments until the issue is resolved. This was last week. I understand that they still have not had confirmed that this subsidy calculator has been resolved. Are you aware of this? Has it been resolved? Are we working on it? Because the concern is that not only can people not get on to enroll, but if they do, their subsidy calculations are incorrect.
So we are aware, meaning the staff is aware of this issue, and they are working on a fix to the system to correct the Alaska issue. It's
in the
specific
meantime,
to Alaska.
What should Alaskans do? Should they stay off, as Enroll Alaska and the other navigators have suggested?
So I will get that information for you.
Watching the news yesterday, I saw that the exchanges will be offline between 1 a.m. and 5 a.m. Eastern Standard Time until further notification. Is that correct information?
So the 1 a.m. to 5 a.m. window is the window that we use to do software upgrades. So that is why.
Oh, okay, and that's fair enough. But unlike what some may believe here, the sun does not rise and set in Washington, D.C. or on Eastern Standard Time. So when a family finishes up dinner, does the dishes, puts the kids to bed in Alaska, 9 a.m. is 1 a.m. So you've got the time period that Alaskans would be able to actually sit and move through any aspect of this exchange, and you're shut down. Can you give me some indicator as to when this might be available for all Americans to take a look at?
Yes, the software fixes will just be done, during this month. As we've said, we were trying to complete the upgrades this month. So.
Okay. So if we're in the situation where we've got a concern with the subsidy calculator in the state, we've got maybe 3 people who may be enrolled correctly, we're not sure yet, we can't get onto the exchanges when most people would have an opportunity to do so when they've got some downtime. I'm having Alaskans coming to me and saying, okay, what happens on January the 5th, I have an incident where I need my insurance. My insurance has been canceled. 60%, just about 60% of the folks who receive their insurance through Primera, which is our largest health insurance by a long margin, have received their cancellation notices. So you've got that going on. You can't get onto the exchanges. We're all saying that this exchange is going to get worked out. But what they're coming to me and saying is, what happens if something happens to me and my family that first week in January? If I have been able to apply for coverage timely, but for some reason, there's a glitch in the confirmation, getting my premium check. If there's a health crisis in January, is it the individual that's on the hook? Is it HHS because there's been a glitch here? They want to know, if I fall through the cracks, am I going to be taken care of? And I don't have an answer for them.
So, first of all, just a reminder, this is 4 hours of the day for a short period of time.
Oh, I understand that. I understand that, yeah.
Okay?
But it's very significant.
I understand.
4 hours.
The call center is available 24/7, and that's true in Alaska as well. So individuals can go in the call center and get help. They can also, if they want to, submit paper applications, which would be processed and returned to them. So they shouldn't wait, is my point.
Right. And come January 1, what happens then? Who's on the hook?
So they would have time
together
before January 1.
Thank you.
Thank you, Senator. Senator, let's see, I got to figure out who's Senator Warren is next.
Thank you, Mr. Chairman, and thank you for holding this hearing, and thank you, Administrator Tavenner, for being here to provide us with an update. I want to talk about Massachusetts. Everyone's frustrated by the first few weeks of healthcare.gov, and everyone's looking for answers, including me. But last week, President Obama came to Boston, where he said health reform in Massachusetts, like the Affordable Care Act, is not a website. It's a values statement. And the president is right. Leaders in Massachusetts, like generations of national leaders, sought to reform health care, not because it was easy, but because we all knew that the old system was broken. For years, costs exploded, insurance companies discriminated against people with pre-existing conditions, too many consumers and patients, including those with insurance, were threatened with financial ruin if they got sick. Now, there have been a lot of comparisons between the ACA rollout and our experience in Massachusetts. And what I can tell you all from experience is that getting everyone into a new healthcare system wasn't easy and it wasn't quick. In the first month that people could sign up for subsidized coverage during our health reform launch in 2007, we got 123 people enrolled. But because we were committed to making the law work and making sure that people had affordable health care, we kept working on it. We fixed the problems, we hit the pavement, we did whatever it took to get people signed up. Our enrollment period for subsidized insurance lasted almost a full year, and yet it was only in the last month that 20% of the total pool got themselves enrolled. People signing up for unsubsidized insurance had a shorter period of time, and yet over a quarter of them waited until the last month to get enrolled. I understand that the beginning of an enrollment period is important. It allows people to shop and to carefully evaluate their options. But what we learned in Massachusetts is that when it comes to enrolling in health care, many of us wait until the end to get it done. So, Administrator Tavenner, what did the administration anticipate would be the pattern of enrollment through the exchanges? What would it look like over time prior? What were you thinking about prior to the launch of healthcare.gov? And do you think that the early problems you've had are going to affect the long-term pattern in enrollment?
So we always assumed that we would be able to enroll folks throughout the 6 months, but that the greatest surge would come in December, because we thought there were people who'd want to get covered January 1, and then the second surge would probably come late February, early March, by those individuals who probably weren't as motivated to get insurance but understood they needed it and it was required by law. So we had enrollment figures, but they were lower for October, and I think they will be low, and it pretty much follows the Massachusetts experience, and that was part of the reason for such a long enrollment period in the first year.
So you still are confident that you've got time, if you can get these problems fixed, to get people enrolled?
It's important for us to get the problems fixed in November, but yes, I think we have time.
Well, good. I know we agree that the problems with the website are unacceptable, that they need to be fixed, but our experience in Massachusetts suggests that it might be prudent for us to take a deep breath about this. I'm sympathetic to your position. The launch of our own Health Connector website for insurance wasn't smooth, but we kept working on it. And when we had data mapping and volume problems during our launch in 2007, we kept working on it. And when we needed our own tech surge to fix it, we kept working on it. We kept working on it because we stayed focused on what mattered, our conviction that no one deserved to be bankrupted or shut out of the health care system when they got sick. So, thank you, Mr. Chairman.
Thank you very much, Senator Warren. Now, Senator Whitehouse.
Thank you, Chairman. Like Senator Warren, I'd like to talk about my home state's experience. Governor Chafee, who was a Republican member of this body, decided that early on that he was going to do this and get it right. And we may be a small state, but we're a pretty smart state. And he put Christy Ferguson, who some of the people who've been around here a while might remember as John Chafee's staffer on this committee years ago, in charge of the project. And I want to say that in Rhode Island, it's been a success. The first time that I went to visit, I walked through the front door. It was late afternoon. It was probably 5:30 or 6. I think it was on a weekend. We're open all the time to make sure people can come in. And there was a family, mom, dad, 3 little kids, and they were at the reception desk. And they had just come in. They'd come in earlier in the day, and they'd been served and explained, walked through the whole process. And they were so thrilled with what they'd heard that they had gone out, and this was their return trip, with 2 big boxes of Dunkin' Donuts coffee and a stack of donut boxes, because they wanted to give coffee and donuts to everybody who was working in the call center, because they were so happy. I walked around the call center and talked to people who were taking the calls and dealing with people over the computer, and one woman was just beaming. And I asked her, well, you look like something wonderful just happened. Why are you've got quite a smile. She had just talked to somebody who was paying, I want to say $800 a month into COBRA, and had just found a better plan for $500 a month. And $300 a month is actually a pretty big deal in that family's life, and so she had had a really wonderful exchange with that person who had called in. We have people, when they come in live, who are actually they are taken out of private rooms to discuss it. When people find out what the deal is, we have a lot of people who they're getting hugs. And there's a story in the New York Times today about a woman who burst into tears of joy when she found she'd get coverage. In fact, I'd like to ask unanimous consent to have that New York Times study put into the record. So there's more than one story about this. And like I said, Rhode Island isn't a very big state. And we made this work.
and it's worked actually pretty well. We have a glitch recently where the hub was down and a couple hundred people couldn't get through. You've solved it. We're working through that. But when I see these much bigger states who didn't even try, and now everybody's sitting back complaining that the federal government didn't do it for them well enough, there's a part of me that says, well, you know, next time, stand up and give it a try yourself. You know, you don't have to be just a recipient. And we're up nearly 4,000 people enrolled but not paid. We're 10,000 accounts about of people who are working through the process, but they've got their account established. We've got all these wonderful stories. So there's another path. And we're all very sorry that you guys had this botch of the healthcare website rollout, but it shouldn't mask that underneath it, there's a plan that is making a lot of families really, really happy. Really, really happy. And if you go to the front lines and go to your state exchange and see what people are seeing, you'll see a lot of those stories. They're happening really across the board. So there's more to this. And if you didn't want to take the trouble to bother to set one up yourself, it's a little nervy to be complaining that the federal government didn't do it for you well enough when you perfectly well could have by yourself as a state if you'd simply saddled up and done it. I'd also, you know, there are these letters that people have been talking about that people have gotten. When we got this started, you remember, we were dealing with a health insurance industry that was so cold-hearted that when it took a client who'd been paying premium for years and suddenly came in with a big claim, their first reaction wasn't, how do we help this family? It was, let's look back in the records and see if we can find a way to disenroll them and get rid of this liability. Ooh, they had acne. Is that a pre-existing condition they didn't disclose to us? Can we throw them off? I mean, that's the attitude. So there's some pretty nasty stuff, I think, that is happening through some of these letters. I want to use the example of Rhode Island Blue Cross Blue Shield. I'd like to put their letter in the record. It is a wonderful, terrific letter. It's very clear. It lays out what your choices are. It says, if you like what you've got, you can keep it, and here's how. And it says, if you don't like it, if you want to use the exchange, here's how. It's 3 steps to stay in Blue Cross Blue Shield of Rhode Island. It's 2 steps to get onto the exchange. There's another way to do this. And I think Rhode Island has done it right, and as a result, we're seeing pretty low drama. So good luck getting through this mess. It has been frustrating for all of us, but I think it's pretty safe to see that across the river, there are broad and sunlit uplands, to quote old Winston Churchill, broad and sunlit uplands for us to go to. Thank you, Chairman.
Thank you, Senator Whitehouse. I know, Mr. Tavener, you have just a hard time that you have to be out of here also. I wanted to make it so that people could have 5 minutes and have a chance to ask another round. I'll just say, first of all, I thank Senator Whitehouse for mentioning the Rhode Island thing. That will be put in the record. Also, Senator Isaacson asked earlier for an IG report to be made a part of the record, and I wanted to say that that would also be made a part of the record also. I didn't mention that at the time. Again, I think I like what Senator Warren said about I think it was President Obama or someone said about this new Affordable Care Act, or Obamacare, if you want to call it that. It's just not a website. It's not about a website or some technical fix. It is a value system. Do we like the old value system, where people couldn't get coverage? Where if someone got sick, they would drop your policy, cancellations. I hear so much talk from my friends on the Republican side about all these cancellations. I didn't hear much in the past when insurance companies would just automatically cancel you if you got sick, or wouldn't renew your policy if you had cancer or breast cancer or something like that. I didn't hear much about that. What we're saying is that's over with. That old value system was no good for this country, because too many people, like Mr. Streeter that I mentioned in the beginning, that was in Mr. Christoph's column on Sunday, or I could mention Kathleen Ferguson from Des Moines. 8 years ago, her son died at age 33, and she said, "My son died needlessly because he had a pre-existing condition and could not get insurance and could not get the medication he needed." I want us to take better care of each other. I'm grateful that people with pre-existing conditions can now get coverage. That's the old value system. Mary Lapis from Swisher, Iowa wrote, "Tell me about her brother. He'd been trying to find insurance to cover his wife for years. He tried to buy coverage with a $50,000 deductible, but no one would sell her a policy. But he logged on to the Federal Exchange. He enrolled himself and his wife, saving $700 a month on what he was paying before." Mary Lapis writes that the ACA gives folks with chronic conditions a chance to avoid bankruptcy, a new value system. I guess there's going to be disruptions and things like that when you're moving from that old system to a new system. And certainly we have to make sure that we fix these problems in the website and other things. I will refer again to what I said earlier about security. Paramount, I think that's maybe one thing that we all agree on here, is that security is paramount in this system. But in terms of the system itself, it's going to work. It's going to be better for this country. I might say in terms of these cancellations, I love the Rhode Island letter. It was very clear. Blue Cross Blue Shield of Rhode Island sent a letter out and said, "Don't worry, nothing is set in stone yet. You still have choices." And they give another page, said you can either stay with us or you can go on the exchange. But they said, "Don't worry, you've got plenty of time." That's the cancellation notices. In the past, you know what a cancellation notice was? You're no longer eligible for insurance. Good luck. That was the old cancellation notices. Now you have choices and options. So again, as I say, people have to take a deep breath and get more people to understand what's going on. Now, I must say that there was a story the other day in the paper about somebody said, "Well, gee, now I have to take this policy that covers maternity care. But my wife and I aren't having any more children." I don't know, they were older or something like that. "Why should I have to have a policy that covers maternity care?" And I got to thinking about that. I thought, well, you know what? Maybe because my wife and I don't have any more children and they're growing up, maybe I shouldn't have to pay property taxes to pay for my local schools. Not my kids there anymore. Why should I worry about it? Maybe only the people that have kids that go to the public school ought to pay for it. No, we're better than that in this country. We're talking about being a part of our society. It's to our benefit, my wife and I, to pay our property taxes, to support our local schools, because that's our next generation. We want them well taught. We want good paid teachers, well-paid teachers. Same way with health care. It is a value system. I am indebted to Senator Warren for mentioning that. And the value is that no one is going to be left behind. No one is going to go without insurance. No one is going to have to wait until they get advanced colon cancer or prostate cancer or breast cancer before they can go to the emergency room and get help when it's too late. That's the new value system. And we're not turning back. Fix the problems, move ahead, but let's aggressively get people enrolled in this system and have a new value system of health care in America. I've used up my time, Senator Alexander.
Thanks, Mr. Chairman. Thank you, Ms. Tavener, for being here today. And the chairman is describing the fundamental difference of opinion that we've had for about 4 years here, because the value system that he likes, I believe, is a value system that transforms our health care delivery system in the wrong direction by expanding a system that we already knew cost too much. And the result is increasing premiums for millions, canceling insurance plans for millions, destroying relationships with doctors for millions, raising taxes by $1 trillion, forcing people into Medicaid, spending $500 billion Medicare dollars on new programs instead of investing in Medicare to make it more solvent, and encouraging employers to work, to have their employees work 30 hours instead of 40. That's not the value system that I support. And we have a different approach, which would say, let's encourage competition, let's encourage choices, and let's try to make health care cheaper so people can actually afford it. But that's our fundamental difference. But may I ask you, Ms. Tavenner, don't you know now, with the improvements in the website, how many people are trying to sign up every day for Obamacare, how many are succeeding, what their level of insurance that they're buying is, what zip code they live in? Don't you actually know that now?
That's the information, Senator Alexander, that we are putting together and we will have available next week.
Oh, next week?
Yes.
You're going to
Mid-November, and that's what I'd said all along.
You're going to release it once? I mean, why don't you release it daily?
So we had said all along, long before the program went live, that we would do monthly data very similar to how we do Medicaid, how we do Medicare.
But this is a little different. This is people who are making decisions, people who are going to lose their insurance starting January 1, people who have to sign up by December 15.
And I would say that's all the more reason to do it monthly, because the fact is, this is early on, and people can decide to go in and out, and they don't have to make payments till December.
But the people who need to know about it are members of Congress who've appropriated $400 million. Let's say I'm a governor in one of the states that hasn't decided whether to expand Medicaid. I'd like to know whether 90% of the people who've signed up are going on Medicaid, or whether it's 80, or whether it's 70. You know, and if we can know how many hamburgers and cars and records are being sold every day, why can't we know how many people are enrolling in Obamacare? If it's such a success, wouldn't that promote the success of the program, build confidence in it?
And we'll have that information next week.
But that's once. I mean, why don't we know it every day? I mean, you know it now, right?
We are in the process of putting together that information.
But we're the United States Congress elected to represent the people. And we're entitled to know answers to these questions so we can make our judgments about what to do. So are governors, and so are the consumers across America.
I understand.
As far as the example I used of Emily from Tennessee, from Cover Tennessee, isn't it true that the Cover Tennessee program was simply canceled by Obamacare? I mean, it's a case of Washington saying that insurance isn't good enough for you, so you can't buy it anymore.
First of all, I don't think it was canceled by Obamacare. I think the insurance company made a decision to cancel a policy and offer something else.
Well, now here's a letter from the state of Tennessee, which has now disappeared, which is I pushed the wrong thing, but I know what it says. It's a letter from the state. It's a letter from the state that says, Cover Tennessee won't be available starting January 1. This affects all Cover 10 members. The new federal health care law will bring many changes, including new health insurance coverage options for Tennessee. The Obamacare said if the law had maximum limits, that if you didn't meet the standard for maximum limits, you couldn't offer that insurance anymore. That's the law. So in this case, for these 16,000 Tennesseans, Obamacare said that insurance isn't good enough for you, and so Emily can't buy it anymore, and she has to pay $6,000 more. Isn't that true?
I think we've been down this issue before. They could have been grandfathered in. They could have kept their...
No, ma'am. No, the law says that if the state program doesn't meet the maximum limits, it's outlawed. Does the law not say that?
For new plans, I'd have to look at...
No, for the old plan. For the old
there was an opportunity for old plans to be grandfathered in.
Ms. Tavenner, there are provisions in the law passed in 2010 that say if a plan doesn't meet the maximum limits, the plan can't be offered. Tennessee...
So you're talking about lifetime limits and this sort of thing.
That's correct.
I'll be glad to get you that information.
So the fact is, Obamacare outlawed that plan, and millions of Americans are having their plans canceled. Why don't we put the President's words into law and say, if you like your plan, you can keep it and end the debate? My time's up. Thank you, Mr. Chairman.
Thank you. Senator Baldwin.
Thank you, Mr. Chairman, and I thank you for staying around for a second round of questions. When I had my first opportunity, we were talking a little bit about the situation in the state of Wisconsin, and we're just hearing a lot of people reference this idea of if you like your insurance plan, you can keep it. In the state of Wisconsin, a lot of people like Badger Care, but because of the decision of our governor, having nothing to do with what Congress did years ago, 92,000 people who may really like their health care plan are being kicked off. Because of this, I really think it is a shared responsibility to figure out how to most effectively help these 92,000 people transition from Badger Care to participate and enroll in the federal exchange. And so I want to sort of ask the companion questions, if there's a shared responsibility, what specific steps can the administration take to ensure that these individuals are enrolled as soon as possible, but also what options are available to the state of Wisconsin to eliminate the risk of losing this Badger Care Medicaid coverage January 1st?
So let me take that in reverse order. Obviously, Wisconsin, like every other state, had the ability or could have expanded Medicaid at no cost. So about 25 states have elected to do Medicaid expansion, including many Republican states. But obviously, Wisconsin was not one of those. So what we are trying to do is we are working part of the process. We'll work with the state of Wisconsin, with the Medicaid office, to identify those individuals and make sure they are aware of what is available on the exchange. Obviously, there's a cost to that, and so you get into the issues of subsidy and this sort of thing, but we will try to work with the state closely to help those people at least identify what's available to them. It's unfortunate.
And what sort of means, I mean, earlier you asked questions about, you know, how do you target young people to get the young, healthy people? How do you target these 92,000 people, and what's the state role? What is the administration role when the state decided not to expand Medicaid?
Obviously, the state knows who these individuals are, so they'll be able to send them information. What we're doing under the waiver is asking Wisconsin to give us a plan on how they're going to do that. So it's a shared responsibility. We obviously aren't sitting inside Wisconsin, but we will try to help.
I just have to say, as commentary, before the exchange marketplace opened, a letter went out from the state, and you were mentioning that the state's aware of who these people are. Well, it basically said someone in your household may be on Badger Care and may be losing it, and that type of information, in my mind, is not adequate to assure that people don't have a lapse or a gap in their health coverage. I guess the other question in my remaining time relates to the experiences of those states in the country in the early phases of this marketplace. What is their experience versus states in the federal exchange like Wisconsin in enrolling people? What comparisons can you make at this point? And can the 36 states that rely on healthcare.gov and the federal exchange expect similar results when the technical issues with the website are fully worked out?
So yes, I think we would obviously expect the similar results to what the states are seeing. I think we've released some information around applications submitted. Some states have talked about that publicly, but that it will be part of what we release next week. But yes, we would think the federal, if you look at Texas, Florida, there's some very large states with large numbers of uninsured, so that will be part of our targeted campaign too in December and beyond.
And with regard to the state-based exchanges, state-based marketplaces, can you talk about any of the successes that they've had or challenges in the early phases of enrollment?
I can certainly, I think many of you have read about Kentucky. Kentucky's certainly been a successful state, both on the Medicaid side and on the exchange side. Their governor has been obviously 100% behind this. He's led the effort. And so they have released some numbers publicly, and I can get those to you. Washington State was another, New York, California. There's states all in varying process, but this will be part of what will be reported out next week.
Thank you, Senator Burr.
Thank you, Mr. Chairman. Mr. Chairman, since you ended with a story, let me talk about Mr. Hood, who lives close to me in North Carolina. He now pays $324 a month for a plan with a $10,000 deductible. Under the new law, the comparable plan suggests for next year he'll pay $895.27 per month with an $11,000 family deductible. Their annual health care payment would almost double from $14,000 to $24,000. And he is unlikely to be eligible for a subsidy. Let me just suggest that the reason that Congress has covered this so thoroughly is this could be a hell of a lot easier. And I might remind the chairman that Dr. Coburn and I came up with an alternate bill. We were denied the ability to amend on the floor of the United States Senate and to offer an alternative. And that alternative took care of pre-existing conditions. It kept children on their insurance longer of their parents. It actually accomplished many of the things that Republicans and Democrats highlight about the Affordable Care Act, but it didn't get into a large top-down government-designed program that picks winners and losers. And when you can have stories that are as passionate as yours, and I can have stories as passionate as mine, clearly the system we have designed picks the winners and losers. It's not individual Americans who get to choose what they want, who get to choose how much exposure, how much benefit. In other words, their health care coverage matches their age, their health condition, and their pocketbook. And that's not what this does. Let me ask you, Ms. Tavener, what's the target enrollment number for the end of November for the exchange?
For the end of November?
Yes, ma'am.
I think that we were looking at between October and November, I think that number was, I want to say around 800,000.
Okay. On April 1 of 2014, insurers are required to begin submitting bids for the 2015 plans. An extension was granted on enrollment to March 31st. So for many Americans, they're not going to sign up till next year. Considering that insurers will have no experience or very little to go on, which is to base their quotes on 2015, what accommodations will you make to ensure insurers make informed decisions?
So I think the open enrollment period was actually we worked in cooperation with insurers, so they think they will have the information necessary to
So they still, between April 1 of 2014 and April 27th of 2014, will have to submit their cost for their plans for the 2015 plan year.
They will submit that over the second quarter of 2014, yes.
Without much experience of what the plan mix is that they're current.
Well, I think they will have the experience that they've had for the first 4 or 5 months, yes.
Well, again, there are many people that aren't required to sign up until March 31st. That's the month right before April. In other words, a day before they start submitting. You said earlier in your testimony that all the fixes done by CGI would be required without additional fees, and that's in a cost-plus contract. Can you assure the committee that there will be nothing on the plus side that the federal government pays to CGI for their repairs on a website contract?
So the cost-plus contract is already paid or planned for payment through March of 2014, so I'm assuring you that that's the contract that they will operate under, yes.
I'm asking a very specific question, though. There's a fixed base part of the contract, and there's a plus base part of the contract. I'm sure that the plus base deals with additional work done over the scope, over the stated scope of the contract. Clearly, fixing this exchange was not part of the stated scope of the contract, I don't think. We haven't seen it.
But it's required of their work in their existing contract. They have to fix these problems.
Well, let me say this. Do know that many of us are going to be looking at the payment that's made on the plus side to see if, in fact, we are paying CGI for their individuals to fix a website that they were contracted to produce for the federal government. Again, I thank you for the work that you've done on this. I know this is not fun to come up and answer the question. I would say that the moral of this story is the more we share up front, which we haven't on the Affordable Care Act, the more informed all members are. Thank you, Mr. Chairman.
Thank you very much, Senator Burr. Again, Ms. Tavener, thank you very much for being here and for being forthright in your answers. I thought this was a good session. I think that you and your staff understand some concerns that both sides have on this. I think there were legitimately good questions pertaining to that aspect of it. Of course, as my friend from Tennessee points out, we still have some philosophical differences on this issue. That's fine. But there are some points, I think, on which both sides agree that we need to ensure get fixed going forward, and I think we expounded on those quite forthrightly. But thank you very much, and as I said, the record will stay open for 10 days for other statements and questions. Thank you, Ms. Tavener. The committee will stand adjourned.
Well, like last week on the House side, today's testimony by Marilyn Tavenner will be followed tomorrow by Health and Human Services Secretary Kathleen Sebelius. She'll be before the Senate Finance Committee to answer questions about the rollout of the health care website and more. And by the way, today